Welcome back, my people. Before we continue, let me start like I always do by thanking you for the continued support you are showing me. Thank you for the subscriptions, thank you for the likes, and thank you for the comments. It's only because of you that this channel is where it is at the moment. We have come across so many obstacles on the way, but we are not giving up. We will still keep on pushing and educating you the way it should be. So, lovers and haters, friends and non-friends, let's put our differences aside and focus in getting knowledge about common conditions that affect human beings in our society. So let's continue subscribing, sharing, and more so liking our videos so that they may be recommended in the whole world. Let's get back to our point of discussion. And the next topic we are going to discuss is what we call gastroenteritis, all in short, GE. And more specifically, we are going to talk about viral gastroenteritis, which can also be called a stomach flu. Flu doesn't always mean a running nose. Gastroenteritis, viral gastroenteritis can also be called a stomach flu. So, viral gastroenteritis is an inflammation and irritation of your intestines caused by one of a number of viruses, mostly common norovirus or rotavirus, and this illness is also called stomach flu, as I have said above. Gastroenteritis is highly contagious. That means it can spread so easily and fast. So it's highly contagious illness and spreads through close contact with people who have the virus or through contaminated food or water. It can spread through coming in contact with people who have it or through contaminated food and water. I've not said any food or any water, but it must be contaminated. Clean water, it can't spread this kind of a disease. That's why I'm putting it as contaminated food or water. It can easily spread in close quarters, such as number 1, child care facilities, number 2, schools, because of the close contact and a big population, nursing homes, and cruise ships. What are the symptoms of gastroenteritis, specifically viral gastroenteritis? It begins shortly after infection. A point to note, symptoms from adenovirus may be delayed 3 to 10 days after contact. So if you get contact with this virus, the symptoms of adenovirus, which mostly goes together with rotavirus, the symptoms can delay up to 3 to 10 days after contact. So, depending on which type of virus you have, symptoms can last anywhere from 1 to 14 days. That means barely 2 weeks. And the symptoms include the following. Number 1, loose, watery diarrhea for 3 or more times in a day. Number 2, fever or chills. Number 3, nausea and vomiting. Number 4, headache, muscle aches or joint aches. Number 5, sweating or clammy skin. Sweating or clammy skin. Number 6, obviously there must be abdominal cramps and pain. You may call it abdominal cramping or abdominal pain. Next point, we have loss of appetite. A point to note, diarrhea caused by viral gastroenteritis is not usually bloody. Note this, it's not usually bloody. So if you see a person having a bloody diarrhea, don't rush and conclude that it's a viral gastroenteritis. Diarrhea caused by viral gastroenteritis is not usually bloody. Blood in your stool could be a sign of a more severe infection. This is where laboratory tests comes in to confirm whether it's a viral gastroenteritis or another severe infection. When should you seek for a medical advice or a medical emergency treatment? When? So, seek emergency medical treatment if, number 1, diarrhea has lasted for 2 days or more without getting less frequent or reducing. Diarrhea has lasted for 2 days or more without reducing. So it means the diarrhea is getting worse. That one, you should seek medical advice or emergency. Number 2, if your infant develops diarrhea. Once your infant develops diarrhea, get a quick medical attention. Number 3, if blood is present in your diarrhea, when you detect blood in your diarrhea, seek an emergency medical attention. Number 4, if you show signs of dehydration, for example, dizziness, let me repeat this point. If you show signs of dehydration, for example, dry lips or dizziness, sunken eyes, and if the child is crying and no tears, the child might be crying and no tears, this is always a sign of dehydration. The child might also have what we call reduced urination or less wet diapers. This will always show that the child is having dehydration, and it should make you seek an emergency medical attention. Guys, this marks the end of our first video about gastroenteritis, which is viral gastroenteritis. And in our next video, we'll be talking about the causes of viral gastroenteritis. And I do appreciate your time. Thank you for being with me all through this journey. And I hope we'll continue being together as one family. So guys, have a good evening, and let's meet in the next video about the causes of viral gastroenteritis. Have a good evening.